I think one of the biggest misconceptions that I'd like people to know about is with latent TB, that if you have latent TB, you need to get treated. And even though you're not showing symptoms and you're not walking around, having all the bad experiences that I experienced and others have experienced, you could. And at any point, something could happen in your life and you could become full-blown TB if you're not treated. And you need to go through with the whole treatment and not treat it like it's not important.
I know that I am in a unique situation, and that as both a physician who has treated many TB patients in the past, and also having TB, tuberculosis is such a terrible, terrible disease. Not only because when one is sick with it, it just consumes everything, but it is also something that can remain sleeping for a long time and can sneak up. So we talk about latent tuberculosis infection, meaning that I have tuberculosis sleeping somewhere in me.
I've had TB tests many times, and I never could pass a skin test, but so nobody ever expressed any concern about it. It wasn't until I got in the TB system with doctors and nurses and stuff that I found out something called latent TB, and I never heard that word before when it comes to TB. Nobody ever expressed any concern. They never, I wasn't infectious, so they just kind of put it to the side. That's one message I'd like to get across today is, latent TB can be treated, and it can be treated very easily without going into a hospital.
The challenging part of the job is you try to convince them to be on treatment, and they not gonna listen. Especially with the patient with latent TB infection. Because latent TB infection, they don't have signs and symptoms and they don't feel sick. But it's so critical, important for them to be on treatment so that we can prevent them from breaking down with TB disease later on.